Hi, everyone. Welcome to Just Mental Health with Steph and Em, the podcast where we discuss mental health issues from a social justice lens. I'm Emily.
And I'm Stephanie. A quick disclaimer before we get started. We are mental health professionals, but this is not to be taken as professional advice.
We are also aware that our privilege may cloud our perspective on some topics, and we not only welcome but encourage you to message us with criticism and correction. Let's get started. Our business of the week is her username on Fiverr is LK_editor. So Fiverr is a website where you can find freelance business owners. She is a graphic designer, and she does logos, banners, covers, flyers, brochures, invitations, and wedding cards, and all other designing related work. She's in Sri Lanka, which is just kind of cool. But like she does business with people all over the world. She worked with us to get our logo. Actually, we sent her kind of a rough draft, and she spiced it up quite a bit and kind of made it look really nice. So definitely reach out to her if you're interested. And it sounds like she has some reasonable prices as well.
Yes, she's not expensive and she has really good reviews and she's very nice, like really, really nice, and was really good at communicating when we were working with her. So
She was, yeah. We kept sending her like, oh, can you make this tiny tweak? And she's like, sure. And we did that like 50 times.
Yeah, she's great. So I totally recommend her if you need any sort of graphic design. And Fiverr is a great app to just find people, professions to do those things for you, depending on the pay rate and stuff. So you can check that out. Yeah.
So today we are going to talk about how movies and TV portray therapists. Because we have seen a lot of misguided portrayals where therapists in TV and movies are being very unprofessional, unethical, just doing things that a therapist in real life would never ever do. And of course, we understand that this is just movies and TV, but it does have implications, for kind of society's understanding of what therapy is, and what therapists can and can't do. I feel like I've had to kind of explain things to clients that they didn't know because, it's what they've seen on TV. So we'll just kind of jump right in.
Right. And if we can nitpick it, we will nitpick it. That's kind of our thing. No. But I'm sure this is something, I know this is something that all therapists do. There's even a meme that I see going around where I think it's Leonardo DiCaprio. I think it's him in the meme, like sitting down on the couch, pointing at, what you're assuming is the TV, yelling. And it says like, me, anytime I see a therapist on TV doing something unethical. And it's like, that is exactly how it is. And you have to say it. You have to say, that's unethical.
It's so like, I don't know why it's like so bothersome to me. And like, like plenty of things you see on TV like don't actually happen in real life. But like, it's because like people don't know, like a lot of things you see on TV that don't happen in real life, people know don't happen in real life. And this is one of the things where therapy is not always well understood, so people don't always know. So let's start giving some examples, so to better explain what we're trying to say. So a common thing I've seen in TV and movies is therapists being like friends with their clients. So some examples that come to mind. There's a show on Netflix called Working Moms. I really
love
like
that show.
but
that.
I don't remember her name.
Yeah, one of the characters.
The redhead. She's a psychiatrist / therapist, and her friend is her client / patient, and like that's just like you can't.
So unethical. I mean, so I think that show's in Canada, but I'm assuming that the ethical guidelines are going to be similar.
Yeah.
I just can't imagine that that's like totally kosher in Canada to do that. Because here, at least in the state of Kentucky and probably in most other states, you can't have a dual relationship. You can't have a conflict of interest with your clients. It's in our ethical code. So sometimes that can't be avoided if you work and live in a very small town in rural areas. I see that a lot where I live and work. People do have dual relationships because there's no other way to.
And just to clarify, I mean, that seems self-explanatory, but in case it's not clear, dual relationship meaning like they're your client and they're your something else. So your client and your friend, your client and your mailman, your client and your like hairdresser, something like that. But
yes, or like maybe you go to the same church together, and then you also see them for therapy, which would be really weird, but it happens. But, if you can avoid those circumstances, you're supposed to. And obviously, obviously, maybe it's not obvious, but ethically, you should not be a therapist to your friends or relatives. That's almost like just known. So yeah, it's a big conflict of interest, but it does make a really funny show.
It does. And the ways that another example, just real quick, that's coming to mind is in the show Atypical, also on Netflix. Have you seen that?
That's good.
Yeah, so it's about a high schooler with autism, and he sees a therapist, and the therapist, I think her relationship with him, other than she yelled at him, but there was like an episode where she like went off on him, but otherwise I think her relationship with him is pretty okay, but her relationship with his mother, they become like friends, and they just like I think the mother took her to the hospital and she went into labor, and it's just a lot of crossing those boundaries, and this can be an issue because I've had one of my clients at Family and Children's Place. She was a teenager, but so maybe that maybe was also part of it, but she thought that we were gonna just hang out and could get lunch together after she stopped seeing me, and it had to be no, I'm sorry, you can email me and update me on how you're doing, but we can't just hang out, and then she was disappointed, and I've had to have similar conversations with clients, and they didn't know that you can't be friends with your therapist even after they're not your therapist anymore. So
yeah, definitely. And the relationships with their family members is also forbidden, in the code. So you couldn't date a client's father or whatever, or you couldn't, I don't even know. Yeah, you couldn't be friends with a client's mother, like personal friends, because that causes a conflict of interest and a dual relationship. So even their family members become off limits, at least for social workers. So that's the weird thing about these ethical codes of conduct. So code of conduct is what it's called. Psychiatrists and psychologists have a different, and if you listen to the other podcast where we talk about the different sort of titles and degrees and licensures, they all kind of work differently. And so I don't know about counselors, but psychologists and psychiatrists, I think they can't have any dual relationships or any relationships with their clients, like even intimate relationships. But I think it's only for like 2 years after they discharge them. And then it's like, okay. For social workers, you can never.
I think for marriage and family therapists, it's the same.
It's 2 years?
No, it's never.
It's never? Yeah. So, which, I mean, I think that makes more sense and is better, but, that's just the way it is. But yeah, so everyone in their family becomes off limits as far as friendship. And if you are to find, this is just a clinical thing, and then I'll move on. But if you were to find out that you happen to have a dual relationship with a member of a client's family, maybe you didn't know, you have to really assess that, and you might have to end one of the relationships. Whether it's refer the client out and be honest with them, like, I can't see you because I go to Pilates every week with your aunt or something, or stop going to Pilates with their aunt. I mean, you have to make that choice, because as soon as they find out, the trust can be, the therapeutic relationship can be hindered.
And sometimes there's a gray area, at least the way that I would handle that specific example, like going to Pilates with your aunt. Like, I might say, like, well, it depends if we went to Pilates and we were like friends and Pilates versus like we just happen to be in the same class and we don't talk to each other.
Right.
So like certain, there's some gray area, but
you have to use your clinical judgment.
Yeah.
And think, could I defend myself if I got sued? I mean, that's kind of unfortunate.
That's the thing. That's Could I defend myself if I got sued? Yeah.
Yeah. Those are really good examples. When we were talking about thinking about, this topic, I had thought about both of those examples too.
Really?
Because I really thought they were interesting. I did like an atypical. I thought, other than what you had mentioned, I thought she was a really good therapist. The way she interacted with him and sort of how they showed their therapy session going seemed very realistic and professional. And I thought she was doing a really good job with that. So I kind of like that they represented at least that part accurately.
Yeah. I agree.
There's one TV show therapist that I love. I think she's the best therapist that I've seen on TV. And it's probably one of the best shows in my opinion too. It's called Crazy Ex-Girlfriend. Have you ever seen that?
I saw a few episodes. I didn't really.
Oh, okay. You got to get into it, because the first 2 or 3 episodes I saw was like, what? But then you get into it and you realize I just think they handle a lot of issues about mental health in that show really well. And not to spoil anything for anyone who hasn't seen it, but the main character, Rachel, is later diagnosed with something, and it's very it's a diagnosis that often there's a lot of just misinformation about and stigma around. But the therapist that she goes to see really explains it to her in a very good way. The stuff, she even says something like, the stuff you see on TV, the stuff you read about, don't Google it because it's not accurate. It's a lot more nuanced than that, but this is your diagnosis. This is how I came to this. She lists off the symptoms and everything. And that was a real changing point for that character, because once she realized that's what was going on, she was actually able to start seeing her own problematic behavior and things and be more honest. But before you get to that point, the therapist, who I'm gonna have to look up the name of the character and the actress. The actress is like, I've seen her in so many different things. She's been on Broadway. She's very, very talented because there's a musical component to this show. But she plays the therapist, and she's constantly struggling with Rachel as her client because she's so flaky. She doesn't commit. She only goes like surface level. She doesn't actually want to do the work. She doesn't want to be introspective. All things that I'm sure therapists struggle with clients they have. And there's this wonderful scene and song that they give the therapist where it's like, maybe this time it'll be different. And she's like, she had kind of discharged Rachel as a client because of how bad of a client she was. But then Rachel calls her and was like, I'm really ready to work on things. And then like she gets this hope again. And she sings this whole song as she's getting ready for their therapy session. And it's very reminiscent of like the song Maybe This Time. But she's like, maybe this time it'll be different. This is going to be the best therapy session ever. Like, I'm such a good therapist. I'm going to do such a good job. I'm really going to help this client. And then, of course, like, you can kind of see it coming, but the therapy session does not go that way at all. And I just related to that so hard because we all have that, like, we hold on to hope for our clients, and every client is on their own timeline. So you may think they need to be working on this stuff right now and they're not ready, but they might later down the line. They may with a different therapist, just not with you, but you do hold on to that hope. You're like, this time it's going to be different. They're going to have this big revelation, this insight, and they're going to start doing better. And you want that satisfaction of seeing them do better. And it doesn't happen. And you're like, okay, I have to deal with the disappointment.
It's like, have you heard the mayonnaise jar analogy?
No.
It's like, for many people, many clients, every therapist they see, it's like opening a jar that's like if some, like you try to open a jar and you can't open it, but you loosened it up. And then you pass it, hey, can you open this for me? And then they loosen it up more, but they still can't open it. And then you pass it to the third person and they actually open it. But they were able to open it because the first two people loosened it. And so like every time that a person goes to a therapist and maybe they weren't ready, they've like had the jar has been loosened. So they're still like,
oh
yeah.
Well, yeah.
That and like planting seeds, which is like, you know, use that analogy a lot. Like, even if you don't get to see the seed sprout, you still planted it. But yeah, no, I agree that every therapist has had that experience. So I just try to tell myself, well, I loosened the jar for the next therapist, and hopefully they can actually
soothe yourself. Like, I tried. And yeah, the character's name is Dr. Noelle Akopian. I think that's how you pronounce the last name. They call her like Dr. A sometimes in the series. And she's portrayed by the actress. Oh God, I think it looks like Michael Hyatt, but I don't think her first name is pronounced Michael.
How's it spelled?
Michael.
Oh.
So it could be Michael. It could be Michelle. It could be, I don't know, Mitchell. I don't know. But she, I had never known her name, but I'd seen her in a lot of things. She's a very good actress. And I just think that character is really authentic, is a good example of a good therapist. And it's funny, it's comedic, and it plays on a lot of the tropes with therapy too. So I think if anyone's interested, that show's great. What about some more really bad examples of therapy, or things that you remember seeing therapists do and thinking, why? I can think of one person He's very popular, and every therapist I know hates this person because of how bad they are. Dr. Phil. Okay, so like, yeah, it's almost too obvious. Why is Dr. Phil problematic? Because he's not even a licensed clinician anymore, and he's sort of portraying this TV show that he's doing, this reality talk show, TV show, in a way that's also like, I'm also doing interventions and doing therapy with people. And he's not. He does some things, I mean, it's for ratings, but he does some things that I think can be really traumatizing and harmful to some of the people that come to him that have, you see that, you hear their stories and you're like, that person has a lot of trauma and needs a lot of help, like a lot of one-on-one work, building the rapport before you get to these interventions. And he's just like way too blunt.
I haven't watched a ton of him.
We're watching a lot when he was on TV when I was younger. My mom would watch him.
Yeah.
And even then I was like, I don't like this man.
Yeah, but from what I have seen of him, he's very he's not trauma informed at all. Like he's just he's very blunt, and he like holds people accountable, not keeping in mind that the way that they're acting is often a result of their trauma. I mean, it is all just for ratings, which is really just shitty.
Sad.
I mean, like these are people's real lives, and
I do feel like it's exploiting people with serious trauma.
Yeah, and like they're consenting to going on the show, but like still, like they think that the show is actually meant to help them. So yeah, I think that's a good example. I think also like people who don't even portray them, like call themselves therapists, but try to act like they are, like Tyra Banks. She's so annoying. I used to love her show, but she acts like she's
problematic too.
She knows everything, and she like, huh?
Oh, I was just saying she's problematic too in a lot of different ways.
So problematic.
Because I loved her too growing up.
Yeah, like it's just like, I don't know, like people who do not have the credentials but act like they do. And she's not as bad as Dr. Phil, whereas she doesn't actually refer to herself as a therapist or a psychologist, but she talks like she knows what she's talking about. And she doesn't. So
yes,
that's another one that comes to mind.
And I feel like one of the most common tropes that I see with therapists and psychotherapy in movies is, and I really hate how it makes sense that it's a common trope because it's also a common ethical issue that we have in this field, but is therapists having sexual relationships with their clients. That is the biggest no ever. There is never a time when that's okay.
Yeah.
You have a sexual relationship with a client, you will get fired. You know,
you get your license.
You could lose your license and never be allowed to practice again, depending on the circumstances. But, you know, that's probably one of the biggest things that people lose their license over, which is awful. Like, that's disgusting. I mean, your client is in a vulnerable position coming to you. You know, the power dynamic is not the same. They're trusting you, and you're kind of taking advantage of that relationship. You have an obligation as the professional to keep them safe in all ways when they're with you.
And I had this an example, a TV example of that. I was going to mention on How I Met Your Mother. So Robin, do you watch that? Did you watch that show?
No, but I know this example. Yeah.
So Robin goes to therapy, and this one bothers me in particular because it's portrayed as if he's trying to be ethical. He says, "Hey, I can't be your therapist anymore because I'm attracted to you." So then she stops going to him for therapy, but then they date.
Mm-hmm.
You can't do that either. That was good that he said, "I can't see you." Like, if you're attracted to your client to the point where it's affecting your work with them, you have to stop working with them. That was good. But then you have to end all contact with them. You can't date them afterward. And the fact that he's like, that it seemed like they were trying to portray an ethical therapist, like, "Oh, I'm so ethical, I'm attracted to you, so I can't see you anymore." Oh, but no, like that's still not okay either. Like, she already went to him, she already was opened up to him, already was vulnerable to him. The relationship, the power dynamic has already been set.
Yeah.
Yeah.
And because it started out in that way of this person being your medical professional, really. I mean, it's the same, like doctors aren't supposed to have sexual relationships with their patients, you know, for similar reasons. Because the power dynamic is not that someone can easily be taken advantage of in that way. So, and of course we don't want to do that because that is, rape or close to rape, if not actual rape, by taking advantage of that power dynamic. So it's just not good. But there is so much of that on TV, and it's almost like it's definitely put in a way of like, oh, this is hot, like this is, attractive because it's kind of forbidden, and like it's a real intimate relationship, and it's like, don't encourage that. I mean, I guess the point is to show how bad of a relationship that is, okay, but like they're really glorifying it a lot.
Yeah.
Like, please don't do that. Like,
it's like, just don't use the like damaging the client therapist relationship as like a tool in your TV show.
Right.
Like, don't like use it as like that's not, like, don't do that. Like, stop. Like,
just stop doing it. It's uncomfortable and gross.
Yeah, like, it's not something that should be like used. It feels like it's used as a tool. I'm repeating the same words I just said. I can't think of a better way. You get what I'm saying?
Yeah.
Like, I don't know. It should be more respected, I guess is what I'm saying. The client-therapist relationship is not respected enough.
Right. Especially because, well, what we're taught is the therapeutic relation is like 70% of like what helps a client get better is the relationship. So everything you do as a therapist has to be what is in the best interest of the client and what is in the best interest of maintaining the relationship that we have established in therapy. And if it's going to damage the relationship, you don't do it, because you're supposed to be, your job is to be the one person, that they can trust, that they can be completely authentic with and open up to and be safe. And if you take advantage of that, you are traumatizing them.
Yeah.
Because most of the time clients come to you they have trauma of some sort, and you cannot, you just can't take advantage of that. That's going to re-traumatize them. So then when I hear people talk about like things that their therapists have done that were not cool or not good at all to them, and it's like turn them off of therapy, that really upsets me, because you're doing, not only are you ruining that relationship, but you're probably ruining future relationships that they could have with another therapist where they could get better. You're deterring people from getting mental health services. So the trust is like the most important thing in that relationship. So those are just weird. And then there's like there's like, oh, I can't even think of the TV show now that it was called that I saw. This therapist was the worst ever. Well, we'll just have to skip that. But
yeah.
No, I don't know. I lost it. It was it was a TV show that I watched. I can't even remember what it's called.
I believe you. You watched it.
Yeah, I know you. But it was a female therapist. She was like a psychotherapist, psychologist, and she was seeing these clients. And over the course of the show, you realize that she's a narcissist. The therapist, she has real problems because she starts manipulating the clients into doing things that she wants. And then she goes so far and she takes it outside of the therapy session and starts like manipulating things in their real life. Like I think one example is she becomes friends with one of the client's ex-girlfriends, and of course doesn't disclose this to either party, and like uses it to manipulate the situation. And you start to see that like if she's just a horrible person, like through the whole thing, she's getting off on it. She's getting some sort of like satisfaction in from ruining her clients' lives. And that was terrifying to watch.
Sounds like that was portrayed as problematic.
Oh yeah. She was not a likable character, and she was not portrayed as likable character,
which is good because some of these other examples are like it's portrayed as funny or portrayed as romantic or portrayed. But yeah, I think that's a good example that like therapists have mental illnesses too. Like they are definitely narcissistic therapists, and they're not always. Not every therapist is a good one. Not every therapist
should be doing therapy at all.
Yeah.
Just like, and that's with any profession. I mean, we know that not every doctor should be a doctor, because they're not good at it. Or they just don't care about their clients in the same way that they should. And not every person who teaches should be a teacher. It's just, there's always going to be that. And that's why it's important to know what you should expect from therapy. What is like the bare minimum, that you should receive from your therapist, and what is not okay. You should know that as a client, so you can, when you go to a therapist and they do something that is not okay, you can leave, it's not right, and you can go to a different therapist. You're not going to feel like you have to take it or put up with it.
Another we've more so been focusing on ethics so far in this conversation, but another inaccurate portrayal that's not so much an ethical issue but more of a unrealistic expectations kind of issue is like on TV when they just get to the root of the problem in like one session.
Oh yeah.
And it's not always like bad. It's not always like, sometimes like it's like the character that's the therapist is professional and like fine and everything, but it's just like not realistic. Like the first session you do an intake, like you do the paperwork, you get all the basic information, you set your goals, you explain your approach, you answer their question. And then the second session, you have to build a rapport. You have to it just doesn't go that quickly. Not to say that you can't have big breakthroughs early on. Like, sure you can, but it's often portrayed because they have to keep the storyline going.
Yeah, right. Nobody wants to watch you build rapport with someone for 12 weeks and then get to.
Right. And again, I don't have a problem with that. Doesn't like irk me the way that some of these other issues we've talked about, because I know they do have to keep the storyline going, but it again is just a misconception, because I have had plenty of clients that are frustrated with the slow progress.
Oh, yes.
And I did have one that said, like, I think therapy is going well. I just thought it was going to be better in like 3 sessions, like it is on TV. Like, he actually said that, and I'm like, no, it doesn't always work like that. They
That's
do that.
disappointing. Yeah, because
Yeah.
you think, oh, I'll go to therapy and I'll start getting better. And like, no. And that is sort of your responsibility as a therapist to manage those expectations with your client, of saying like I tell clients, typically for most people on average, it could change. It could be different for you, but you got to give it at least 3 months, at least, before you really start to see a change. And a lot of that also just depends on where they are in their stage of change. If they're, and like how many therapists before them have tried to open up the jar. So like how loose it is. Because some clients come to you and like, you can tell that their previous therapist did the work and you're just reaping the benefits. And you're like, I'm sorry about that. But with some clients who maybe have never done therapy before, it could take a lot longer, because you got to build that relationship. You have got to educate the client on things that are going on, normalize things, validate, and then you've got to give them some coping skills for when you get to the trauma, or the root of the issue, so they can handle it. So it does take time. And if you're in therapy right now and you're like, I've been doing this for 2 months and I don't feel any different, just give it a little bit more time. Like, is it that you just don't feel different because you expected to feel better by now? Or is it that you really feel like you're not doing anything in therapy? Those are different things, but give it some more time and talk to your therapist about it.
Talk to your therapist about it.
Yeah. They could let you know, this is normal. Like, or they could say, yeah, I've had clients say, I feel like I'm not making progress. And I'm kind of like, yeah, I feel the same way.
Yeah.
Talk about that, because I'm glad you said it, because I don't want to bring it up. But
usually, I think that is the case. Usually, like, it's sort of like maybe like even like the elephant in the room, where like they don't feel like they're making progress. You also don't feel like they're making progress, but someone needs to say it. Yeah.
Like, we're not going to be offended.
Yeah.
I've had a client say that to me once, and I was like, I could tell he was beating around the bush, and I was like, just say it. I know what you're going to say. And he was like, I don't feel like I'm getting better. And I was like, okay, good. I don't feel like you're getting better either. There's something we're missing. Like, and that's okay, because which really, when we talked about it, it was like, you are making progress. There were things that have gotten better. You just have to go back and look at them that way. But yeah, the progress that you want to see, the progress that I want to see was not happening, because we're missing something. We need to try something different. And that happens a lot. You've got to switch it up sometimes with clients.
That's another thing. When you said, if you really look at it, some things have gotten better that you maybe just didn't notice. Again, at Family and Children's Place, when we used to have to rate the goal every like 3 weeks. So like there would be a goal, and I know it was super annoying. There would be a goal, just so our listeners know, there'd be a goal that you make with the client, and then you start off, there's a 1 to 10 scale. You start off at 1, and then every 3 weeks you like say, do you feel like you've progressed over the past 3 weeks? And you either increase the goal or leave it the same, or decrease it, I guess. And so as annoying as that was, I think it was helpful. Because if over time, like, I'll look back and I would be like, so your number hasn't changed in 3 months. Is that like, do you really feel like you haven't made progress in 3 months? And then they're like, oh, really? No, I feel like I'm doing better from 3 months ago. but it's just in 3-week intervals, they don't notice the difference. But then if they look back and they're like, it's definitely better than 3 months ago, then they have made progress. It's just like they just don't notice it in the day.
Don't always.
It's the same as like when I see my nephew and he's like so much bigger, even though, and then like my sister who sees him every single day, like doesn't see it day to day until she like looks like back at a picture and she's like, oh my God, he's so tiny. It's the same thing.
It is, right, because they're themselves every day. They intimately know their own problems because they live it every day. So yeah, you do, when you're the client, you do focus on the problem. And as the therapist, part of your job is to help the client focus on the things that they are doing good and well, and the things that are going well. And pointing that out every time you see it can help the client too. Like, sometimes I just like to say, like, you know what? 2 months ago, you never would have said that. You never would have told me that, or you never would have referred to yourself in that way. I think that's really good. And they're like, oh yeah, I guess it is. Like, you could see them like change, like, wow, I didn't even know that was a thing. Because everyone needs, you need the encouragement, obviously. And it feels good to have someone say, you're doing a good job.
Yeah.
And validate that, so yeah, you don't always see people get better in therapy on TV. Like I can't really think of a TV show where someone went to therapy and they got better because of therapy. Like, can you?
I mean, in the ones where it gets better in like one session.
Yeah, well, yeah, because they come to like a realization about themselves and that suddenly changes. It's almost like this idea that once you realize what your core issue is, then you will change, which, like, no, that doesn't happen. You know what your core issue is and still keep doing the same thing.
I just thought of some This Is Us.
Yeah.
You don't watch that,
right? I haven't seen it, but I know what you're talking about. I mean, I know the show.
Randall is season therapist, and I'm trying to think of problems, and I don't think there are any problems in that. I think that was actually a really good portrayal, and I think he has. Yeah, I think like the progress he made, the way the therapist interventions she uses, the progress he made, the pace of the progress, the ethics, are all very accurate. And he's a Black man, and he was seeing a white woman, and he actually ended that. He said, like, they showed him calling her saying, like, I got a lot out of this, thank you so much, but I think I need to see a Black therapist.
Oh wow, really?
Yeah, which was really,
that's amazing.
Yeah, this show's so great. I love This Is Us. Like, it's really good because it shows us those multicultural racial issues that are often overlooked, that a Black client is not always going to feel safe talking about racial issues, which have a big impact on their lives, with a white therapist. And it was interesting because she pointed out, so he was I don't think I'm spoiling anything. He was adopted by a white family. And so she pointed out, like, I think did you come to me because of your issues with your mother? Because I as a white woman, like, who am about the age of when, like, you started having issues with your, so, yeah, I thought that was like A+, actually, as far as,
that's really good. So
yeah,
that is an example then. I guess I just haven't seen any, because that's a really good example of a character taking that initiative too, and advocating for themselves in that way by him actually saying, I don't think that that I need to see you anymore because I need to see someone, you know, who of my own race, who can understand these things. And that's great. Clients should do that. You know, if that becomes the issue, you should do that. So that's cool that they showed that example. So yeah, there's good and bad. Obviously, it's TV, you know, or
it depends on the genre. Like This Is Us is a drama.
Right.
I think it's a pretty realistic drama. So they're gonna put effort into making it realistic. Whereas if it's a comedy, you know, it's not gonna be as accurate or as
comedy. Yeah.
Yeah. So that's something to pay attention to. But yeah, should we start wrapping up? I think kind of the moral of this episode is you know, take what you see on TV with a grain of salt.
Don't expect your real life therapy sessions to be like what you see on TV.
Right. Yeah.
And obviously there are things that are very unethical. So if your therapist does that, run and report them.
Yeah, I think that's a huge message. Know your rights, you know, like know what you should, what isn't okay. And if you see your therapist doing any of those things, run, like you said, like, because not every therapist is ethical, unfortunately. So.
Definitely.
So that's our show. If you enjoyed this episode, please share with friends and family.
And don't forget to follow the show's Instagram for updates on new episodes at Just Mental Health Podcast. That is with a period between each word. We record a new episode every week or whenever we feel like it. This is Steph
and Em signing off. Thanks for listening.